to the next installment of Council Connect. I am Lisa Narducci of Central Nurse Triage.
And I'm Catherine Oslam, the coordinator for the Medical Assistant Academy. So Lisa, how were your holidays?
Yeah, the holidays were good. They were very exhausting. Now that we're well into winter, I'm definitely feeling more exhausted.
Yeah, it's very hard this time of year. Winter just kind of keeps going and going, and it's cold, and we're stuck inside, and our vacations are long gone or far away.
Yeah.
So yeah, it's difficult.
Yeah, I know. It's hard to stay motivated. I know one nice thing that they do for us here at the corporate center. We do have a wellness room with a recliner. We have an essential oil diffuser in there that was provided by the management, and it's a nice break room when you need to escape for a few minutes.
Yeah, that's very nice. Our system actually has quite a few resources to help with self-care.
Yeah, so scan the QR code for more information or check them out on our portal.
Good. So I just want to give a quick shout out to our graduates of the cohort 6 of our Medical Assistant Academy who graduated and also passed the exam on Friday. So congratulations to them. And I would also like to say congratulations to our current medical assistants who all passed the certified medical assistant exam as well. So congratulations to them.
Yes, definite congratulations are in order. I do have an update on our urinalysis quality improvement project. Here to tell us where we are with the project is our council representative.
Hi everyone, my name is Joy. I am with the Nursing Council with Endeavor, and I am presenting the Urinary Contamination Prevention Project. So the background for our project is back at the 2024 Skills Fair. We identified that some things were occurring, causing an increase in contamination of our urine samples in the EEH medical group system. Some of the things that we identified that were occurring was not following the appropriate timing of a urinalysis. Staff were dipping a clean dipstick into a sterile urine prior to the collection of the culture, and not educating the patients on the clean catch process. So we started collecting data, and as you can see, January of 2024, our contamination rate was about 8%. Over the course of the last year, to the current January of 2025, we are well over 30% now. So we are not trending in the right direction. So with the trend moving in the wrong direction, that caused us to meet with lab leadership to try to come up with a way to improve our numbers. And the contamination rate by departments ranged from anywhere from 0 to 67%, and overall tripling in contamination rate since April of 2024. The lab did make some pre-made clean catch signs available for our use, and many departments were discovered to have not been using sterile cups for the urine collection and or not using sterile transfer devices when collecting a urine culture. We also identified that sometimes front desk staff or non-clinical staff were providing the urine cups to the patients and not providing the 2 towelettes to the patients when getting the specimen. So currently, many departments use different workflows and different supplies for the collection of urine cultures. And we would like to standardize that across the system. So there's different types being used, and the charge to the patient is about $766 for the urine culture, and the cost to the organization is about $35. But when the urine is collected improperly and is contaminated, it can end up causing some long-term effects. Some of those are listed here. We lose trust from the patient and the staff. It creates longer hospital stays. It causes an increased risk for antibiotic-resistant treatment in the future, and it also creates false positive urine cultures that can lead to adverse effects from antibiotics. So our overall recommendation is to create a process improvement and re-education to staff. We're creating educational videos so that we learn how to teach the patients how to collect the urine culture, and also videos for the staff to provide the education to the patient, and then how to run the urine analysis and how to properly process the urine culture. We're going to create a new workflow where the collection cup is not given to the patient by anyone other than a clinical staff member, so that we can allow the clinical staff to provide education to the patient when the collection kit is handed to the patient. So we're going to take away the urine collection kits from the front desk and also out of any bathrooms. And then we can also at the same time make sure that the patient is getting the 2 towelettes, and then we can educate how to use those 2 towelettes with the collection. We also want to consistently use the transfer device to get the urine culture prior to dipping the urine with the dipstick. We also would like to make sure that if we need a culture and we already did do the urine dipstick, that we recollect the urine so that we have a good sample for that urine culture and it's not contaminated. And then lastly, we would like to standardize the collection supplies so that everybody is using the same supplies across the board. And then it would be about 43 cents per specimen, using the sterile cup, the transfer device and tube, 2 towel, in the same size, and there's no discrepancy amongst the collections. So our anticipated timeframe for the implementation on this was in March of 2025, not 2026. The Nursing Council has started distributing to all leadership the information about the need for re-education and what we had discovered. And I'm also providing the standardization of the ordering information so that all of the supplies will be ordered in a more standardized way. And then updating our workflow updates to leadership so that it can be presented to staff at staff meetings. And then in April, the Clean Catch signs are going to be laminated and placed in bathrooms for patients to reference in English and Spanish. And then there will be a video education in Workday Learning for clinical staff on the urine collection process. And then we will also continue to give monthly data distribution. If you have any questions, of course, reach out to your leadership, or you can always reach out to any of us in the Nursing Council. Have a great day.
Okay, well, it sounds like there's great progress being made. Thank you to our council, and more to come with the education for the staff.
That's great. So, well, that is all for our episode today. Thank you for joining us.
I am Lisa Narducci.
And I'm Catherine Oslam.
This is Council Connect, where we connect with you.